insurance exchange. One of the options. Most of the folks who are going to be offering insurance to the exchange are going to be private insurers. You know, Blue Cross Blue Shield, Aetna, all these. Well, I think one of the options should be a public insurance option.
Choosing. No one with insurance would be affected by it, but what it would do is it provide more choice and more competition. It keep pressure on private insurance to keep their policies affordable, to treat their customers better. I mean, think about it. It's the same way that public colleges and universities provide additional choice and competition to students. That doesn't inhibit private colleges and universities from thriving out there. The same should be true on the healthcare front. Minnesota, I have said that I'm open to different ideas on how to set this up. But I'm not going to back down from the basic principle that if Americans can't find affordable coverage, we're going to provide you a choice. That no government bureaucrat or insurance company bureaucrat gets between you and the coverage that you need. That's a promise. Now, a lot of you might think this plan sounds pretty good, or when you're talking to your friends or neighbors, they might say, yeah, that sounds all right, but let me ask you this, how are you going to pay for it? And that's a legitimate concern. We inherited some big deficits and some big debt. And we've had a big economic crisis that has required us to take some extraordinary steps. So we're going to have to get control of our federal budget. We have to do it. So it's a legitimate question, but here's what you need to know. First of all, I will not sign a plan that adds one dime to our deficits, either now or in the future. No ifs, ands, no buts. Part of the reason that I face these trillion-dollar deficits when I walked into the door of the White House is because there were a lot of initiatives over the last decade that weren't paid for, from the Iraq War to tax breaks for the wealthy. I will not make the same mistake when it comes to health care. Can be paid for by finding savings within the existing healthcare system. Money that's already being spent, but spent badly, wasted, and abused. Right now, too much of your taxpayer dollars and too much of your savings, frankly, are spent on healthcare that doesn't make us healthy. That's not my judgment. That is the judgment of medical experts and doctors and nurses. Healthcare professionals all across the country. We love nurses. I love them. As I said on Wednesday night, this is also true when it comes to Medicare and Medicaid. And Medicare is one of these issues that has been, really distorted in the debate. So I spoke directly to seniors on Wednesday. I want to repeat what I said. We have stood up for 4 decades for the principle that after a lifetime of hard work, our seniors should not be left to struggle with medical bills they can't pay. Remains a sacred trust. It needs to be passed on from one generation to the next. That's why not a dollar of the Medicare trust fund will be used to pay for this plan. Not $1. We will not be lowering benefits for senior citizens.
The only thing that we will be doing is eliminating hundreds of billions of dollars of waste and fraud, as well as subsidies that are going to insurance company HMOs. Subsidies that have their profits for going through there. The other thing we want to do is we want to create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. And that's going to ensure that Americans, seniors, get the benefits that they've been promised. We'll ensure that Medicare is there for future generations, and we can use some of the savings we get to actually fill the gap of costs on prescription drugs that so many seniors are struggling with. We can save them thousands of dollars on prescription drugs. That's what the plan will do for senior citizens. So don't pay attention to these scary stories about how your benefits will be cut. That will not happen on my watch. In fact, the folks who are making the accusations, they're the ones who've been talking about cutting Medicare in the past. I will protect Medicare. And here's the best thing, and this is important especially for Minnesota. Because Medicare is such a big part of the healthcare system, making that program more efficient can help usher in changes in the way that we deliver healthcare that reduces costs for everybody. We have long known that some places, including Minnesota, offer high quality care at costs below average. Look at what the Mayo Clinic is able to do. It's got the best quality and the lowest cost of just about any significant company. So what we want to do is we want to help the whole country learn from what Mayo's doing. We want to help the whole country learn some of the good things that are going on in Minnesota. That will save everybody money. The commission can help encourage the adoption of common sense best practices. Everything from reducing infection rates for hospitals to helping teach doctors how to work together so when you go to the doctor's office, you don't have to take a test each time you see a doctor. You take one test and they email it to every doctor. Common sense stuff like that. Now, this is the plan I'm proposing. It incorporates ideas from Democrats and Republicans. And I'm going to keep on seeking common ground in the weeks ahead. And I've said to everybody in Congress, if you come to me with a set of serious proposals, I'm going to be there to listen, and my door's going to be open. But I also say, some of you heard me on Wednesday night, I will not waste time with people who think that it's just good politics to kill health care. I'm not going to allow the special interests to use the same old tactics to keep things the way they are. I'm not going to let people misrepresent what's in my plan. I will not accept the status quo. Not this time. Not now. Minnesota, we are closer to reform than we've ever been before. But this is the hard part. This is when the special interests and insurance companies and the folks who think, you know, this is a good way to bring Obama down. This is when they're going to fight with everything they've got. This is when they'll spread all kinds of wild rumors designed to scare and intimidate people. That's why I need your help. There have been some of the pundits in Washington who've been saying, well, maybe you've been trying to do too much.